So the aim of Health Navigator is to reduce unplanned attendances and admissions to hospital. What we have identified through years of research is the fact that once patients are frequent attenders and have got into that sort of behavioural pattern, that's when normally within the health service we identify them. As a former A&E nurse, I know that we used to see patients, regular patients, you know, and you knew them by name and you knew them by sight. They're people who constantly attend the A&E because they weren't on the right pathway. Now, the problem with that is once they are in that behavioural mindset, it's very difficult to get them out of it. So what Health Navigator do through their AI model is we have our program sitting on the trust server, and every night by identifying a range of criteria on every patient in the hospital, we can predict those patients who are most likely to become frequent attenders. Because we predict that situation, we can pick them up far more quickly before that behavior has become ingrained and before they feel lost in the pathway. So that's one aspect of what we do, which is incredibly important, you know, just identifying patients at an early stage. And the other aspect is actually the patient management platform, which is our program we call Navigator. And that's actually managing the patients. It's creating a care plan, looking at not a traditional care plan that you'd find in the hospital, but looking at what are the drivers that will take these people back into hospital as soon as that we can work with them to avoid happening. So we can get them on the right pathway to appropriate healthcare for them. So as I say, it's two arms. There's the AI platform, which identifies the patients before they become ingrained into the frequent attender behavior. And then we have the actual Navigator platform, which helps the nurses and healthcare professionals manage those patients through their process with us, which takes approximately 3 to 6 months and helps them to be far more empowered with regards to their own health. When I was working within the NHS previously, and many years ago now, we were one of the first trusts to look at patient management systems, and I worked very closely with Creenagh, and when their office is up in Paddington, from an emergency pathway perspective. So we went there and worked with them at what was a model that was going to work best for the hospital from the front door. So how are we going to manage patients from the front door digitally, if you like, and say work closely with the hospital and with Creenagh to develop that. Going on, when I worked in social care, we looked at a model of mobile care monitoring, so that all of our residents had a care plan that was contained on a mobile device, so that the carers and the nurses could develop a far more person-centered approach to care. So I have had some experience in using sort of digitalization in healthcare prior to coming to Health Navigator. So the innovation was developed originally in Sweden 10 years ago. My role now is working alongside our healthcare teams out in the field to help refine it. So as our model identifies patients who are most likely to become high-intensity users, what information do we need to ensure that we identify these people correctly? And once we identify them, ensuring that the lists that our healthcare professionals receive every day detailing these people, are they accurate? Are they effective? Do they give us the information that we need? So I am, if you like, the interface between the guys in the field and our IT team who are creating this platform and enhancing it on a day-to-day basis. On the patient management side, from the point of view of Navigator, we are always sort of having a cross-section conversation on how we can better manage the patient experience. And so again, I act as the interface between the people on the shop floor and our IT team to look at the best way that we can provide information to the patient and also to our healthcare professionals using the Navigator platform. I think the impact on the service from the AI platform identification and prediction model is the fact that we are becoming far better at really identifying those people that would benefit most from a proactive health coaching approach. And the more that we refine that model, the better we are at predicting people who would benefit. From a patient management perspective, the innovation has been enhanced so that we are, again, far better able to look at those drivers that take people into hospital and therefore work on those drivers with the patient to help them become more empowered. So, for example, if somebody's driver for constant reattendance and readmission is a lack of knowledge and understanding, we can then identify that much more clearly and more quickly and work with the patient to help them develop that knowledge and understanding of their condition, how it impacts them, how it impacts their life, and work with them to therefore manage that more effectively to avoid A&E being their default position, because clearly that isn't helping them. And so we need to find the pathway that will help them. I think just be open to new learning, be open to new experiences. I obviously started my nursing career long before computers, long before any aspect of digitalization, and I've had to learn as I go. But I think not being afraid of it. Realizing the huge potential for enhancing the patient experience. I think sometimes people think, oh, it's because it's digitalization, because it's not the personal touch, therefore it's not person-centered. And nothing from my perspective could be further from the truth, because the way that we work is we utilize digitalization to enhance knowledge we understand of patients, and then we integrate that with the human element of our nurses and our healthcare professionals to work with them from the information we've gained. So I think it's, don't be afraid, be open to new experience. It does enhance the patient experience, and can really do very positive things for healthcare generally. So enhancing all aspects. So grasp the opportunity and don't be afraid of it.